Hello, my name is Jenny and I'm going to be demonstrating today how to administer an oral medication to our patient. The first step that we need to do is prepare the medication prior to taking it to the bedside. So somewhere either in the nurse's unit or at the patient's bedside. What's most important is that we check the patient's medication administration record, and also once we have the correct medication, we double check the medication label and compare that to the MAR at least 3 times to make sure that we do have the right drug, the right dose, the right route, and the right medication. So our patient is Ida Hurt, who is a 79-year-old patient. She's been admitted for congestive heart failure, and the physician has ordered administration of furosemide and digoxin. Okay, so when we do prepare the medication, whenever it is in tablet or capsule format, we do first dispense it into the cap and then place it in the medicine cup. We want to make sure that we do not touch the inside of the container with our hands so that we don't contaminate it. So the doctor has ordered digoxin. So digoxin 0.5, and we check that at least 3 times the medication label with the medication administration record. So digoxin 0.5 milligrams by mouth daily, and medication digoxin is recommended to be given early in the morning. And in this case, we're going to be administering it at 8 a.m. The other medication is furosemide, which is 20 milligrams by mouth at 8 a.m. So the physician has ordered these 2 medications. So the first step to do is to confirm. So we have digoxin, 0.5 milligrams, and I check the patient's MAR, I check the medication label, and I have confirmed that we do have the correct medication. So I'm gonna put 1 tablet of digoxin, okay? And we put it into the lid, and then we place it into the medicine cup, okay? Then we get the other medication, which is a furosemide, which is gonna be 20 milligrams. Okay, so the medication, furosemide, 20 milligrams by mouth, perfect, and we confirm it with the medication label at least 3 times, okay? So we're gonna take 1 tablet and again, put it into the cap and dispense that into the medicine cup, okay? So now that we have prepared the medicine cup, we're gonna be going to the patient's bedside, to the patient's room, and administering the medication. So once we arrive to the patient's room, the first thing that we would do is introduce ourselves to the patient. Hi, Ida. My name is Jenny. I'm going to be your nurse today. Today we're going to be administering a medication for you, 2 medications that the doctor has ordered. Can you please confirm your name and your date of birth? So here we have Ida Hurt. And then confirming also if the patient has any allergies. And in this case, Ida Hurt does have an allergy to penicillin. Knowing these 2 medications, digoxin and furosemide, it does not interfere with her allergy to penicillin. Okay. The other thing to look at prior to administering this medication is the patient's potassium levels, and as well as her electrolytes. So in this case, Ida Hurt's potassium is 4.1. So prior to administering digoxin, we need to make sure that the levels are between 3.5 and 5. So anything less, she would need potassium supplements, and anything over, we would need to stop the digoxin. The other medication, furosemide, we'd also look at her electrolytes to make sure that the patient is not close to dehydration. In this case, her sodium and her chloride, her electrolytes are all within normal limits. Her blood pressure is also stable, and respirations and pulse are also within normal limits. Something to look for with furosemide is the patient's urinary input and output. Since furosemide is a diuretic, that's why there is a concern for electrolyte depletion. As far as the digoxin, we would instruct the patient to let us know if there's any manifestations of nausea, vomiting, irregular heartbeats, and to also avoid any concurrent use with verapamil, and to also advise the provider before taking furosemide, before taking digoxin, if she's, to make sure that she tells the provider if she's taking any antacids. So then at this point, we have confirmed the patient's identity using 2 acceptable identifiers. The next step would be to perform hand hygiene for at least 15 to 20 seconds. In this case, we don't need to don gloves. At this point, we would just make sure that the patient is in a sitting position. So Ida, do you think that we can have you sit up so we can take your medications? Perfect. Okay. It is also important that when we are giving the medication to the patient, that we remain at the bedside and make sure that they take all of the medication. We should never leave the medications at the patient's bedside for them to take later. Okay. All right, Ida heard. So let's confirm. We're going to confirm the medication with the patient's identity. We're going to confirm the medication and the MAR at least 3 times to make sure that we do have the right patient, the right dose, the right route, and the right time. Okay. So we have digoxin, 0.5 milligrams by mouth. And then we also have furosemide, 20 milligrams by mouth. Okay, and it is 8 a.m. Okay. Now, whenever we are administering oral tablets or capsules, something oral to the patient, we would provide them with a fresh cup of water. So here you go, Ms. Hurt. Okay. And so now that she drinks it, and I confirm that the patient has taken all of the medication, I will give the patient a fresh cup of water, about 8 ounces. Okay. And she would drink it. Okay. Okay, so then I would discard the medicine cup, and then just let the patient know that I would be documenting the medication given today in her medication administration record, and would remain in the room for a few minutes. And that's that.